Hi, my name is Opal and I have asthma. And I live in the inner city. Living in the inner city is definitely difficult having asthma. And when I have an asthma attack, I feel like I'm about to die.
Hi, I'm Dr. Elliot Israel, the head of this study. As you just saw, asthma can cause many problems. It hits blacks and Latinos much harder than most others. Patients like you have told us they want to get asthma off their backs. This study will show us if we can prevent your need to visit an emergency room or hospital or miss work or school. Patients like you helped design the study. That's why I'm so excited that you've agreed to hear about the study. In this study, you'll be part of one of two groups. If you're in one group, you will learn a different way to take your albuterol, the quick reliever or rescue medicine, the one you take when you want quick relief for symptoms like shortness of breath or wheezing. If you're part of the other group, you'll learn about a new way to keep your quick reliever and your other medicine with you all the time. The study does not include any experimental medicines. You will continue to receive care from your usual study clinic during this study. For this study, you'll only need to complete the visit and then answer a few questions each month for the next 15 months of the study. It's very important to answer these questions about your asthma and any asthma problems each month. These questions are the only way we will know how the changes you make might be working in the study. This is an important study. We believe it will show us ways to reduce the things that you tell us worry you about your asthma. Having to go to the hospital, having to go to the emergency room, time away from your family or time away from work because of asthma, time lost from school because of asthma. Please only join the study if you're ready to complete not just today's visit, but to answer the short set of questions each and every month. Thank you for joining your fellow patients in the fight to beat asthma. Now, let's review a little bit about asthma.
What is asthma? This animation is brought to you by the American Lung Association. People with asthma have hypersensitive airways. Their lungs react to things that may not bother other people. Asthma can cause significant changes within the airway, all of which narrow the opening, making it difficult to breathe. This is how the airway looks in an airway without asthma. The airway is pink and clear, with no interior swelling, and the muscle bands around the airways are not tight. There is no mucus overproduction. Air moves freely through the open airway. Untreated or poorly controlled asthma can cause changes in the airway that may be irreversible. When you have asthma, three main changes can occur in your lungs. The first is inflammation. This makes airway tissue irritated, red, and swollen. When you have asthma, inflammation is always there, even when you are not experiencing symptoms. When the tissue becomes inflamed, the airway narrows and airflow is decreased. The second change is bronchoconstriction. This is the tightening of muscles that surround your airways, further reducing the opening. The third and final change that occurs is an increase in the secretion of mucus, which further blocks the airway. When someone with asthma comes in contact with an asthma trigger, such as pollen or tobacco smoke, one or all three of the processes, inflammation, constriction, increased mucus production, can occur, all of which contribute to the narrowing of the airway. This is known as an asthma attack or episode.
Asthma is more than just wheezing or asthma attacks, and is not the same for everyone. Asthma can cause coughing, shortness of breath, and chest tightness. Asthma symptoms can be very mild or very bad and can be different from day to day or even morning to night. The symptoms are caused by tightening of the airway or muscle called bronchoconstriction, inflammation, and mucus. Some people with asthma stop doing activities like walking or sports or playing so they will not get any symptoms. But we don't want to let asthma limit you or beat you. We want you to do the things that you like and want to do. 2 things can help. First, use your asthma controller or maintenance medicine every single day, even when you have no symptoms, to help prevent your lungs from becoming inflamed and tight. And second, avoid things that make asthma worse, like tobacco smoke and things you are allergic to, like pets, dust mites, or pollens. There are 2 general types of asthma medicines: rescue medicines, such as albuterol, and controller medicines, such as Asmanex, Qvar, Symbicort, or Advair. Rescue medicines like albuterol are used to give you quick relief when you have symptoms. They help open up the airways. Rescue medicines also can get the controller medicines added help when you have more symptoms. Controller medicines like Asmanex, Qvar, Symbicort, or Advair are also called maintenance, regular, or daily medicines and are the main medicines to treat asthma. Controller medicines work by decreasing inflammation and mucus in the airways. You won't feel them right away, but they are working to calm the airways down. Using a controller medication is a long-term investment. The more you control the inflammation, the less you'll need to use rescue medications. Most asthma medicines come in inhalers, but not all are taken exactly the same way. To get the medicine into the lungs, it is important to use your inhalers correctly. Ask your doctor or nurse to watch to see that you are using them the right way. The main controller or maintenance medicines are inhaled corticosteroids, commonly called steroids, which include inhaled steroids. The asthma steroids are safe. They are not the same type of steroids sometimes taken in large amounts by athletes. Some people are concerned about taking asthma medicines every day and think they will become addicted to them or that the medicines won't work as well when you need them. You can't become addicted to asthma medications. The controller or maintenance asthma medicines are made to be taken every day to control inflammation, even if you're not having symptoms. If you have a sudden increase in symptoms like shortness of breath, trouble getting your breath, or chest tightness, you can use your quick reliever or rescue medicines. Call 911 for immediate help if the trouble breathing is so bad that you cannot get enough breath to walk, talk in full sentences, lay down flat, or if you feel you just can't get your breath. Remember, asthma is there every day, even when you are not having symptoms. Your asthma is still in your lungs and needs to be treated. Taking your asthma medicines every day is the best way to be symptom-free and not be bothered by your asthma.
By taking my asthma medication and avoiding my asthma triggers, I can get on with my normal life.